Welcome to Road to 250. Today we're going to review some questions. First question. A 32-year-old woman comes to the physician because of a fever of 38.4 degrees Celsius and a diffuse macular rash on her torso. Her blood pressure is 92/51. The physician obtains a culture from her vagina that shows catalase positive, gram-positive cocci. For the next few days, the rash on her torso desquamates. Which of the following organism is most likely responsible for this patient's symptoms?
Catalase D?
Yeah, D for dog.
Correct. What does she have?
TSS.
Correct.
Toxic
Which
shock
of the organisms on here also cause TSS?
Pyogenes.
Okay, and what's the differentiation factor between those two?
One is toxic shock-like syndrome versus toxic shock syndrome, but something better than that is that
Strep is catalase negative.
Good job.
Is there something about like the whole? Do they manifest a little bit differently? I don't know.
A little bit, but I think the biggest clue here was because of catalase positive, and this is catalase negative.
Yeah.
All right, so the answer is D, and obviously gram-positive, catalase positive, and it produces a super antigen. But he can also produce toxic shock syndrome, but it's catalase negative. All right. Any questions about this one?
Nope.
Cool. 12-year-old girl is brought to the pediatrician by her mother because of a fever. The physician notes that the girl has features of albinism, and the mother states that her daughter has always looked the way she does. The physician diagnoses the girl with streptococcal infection and prescribes a course of antibiotics. 3 months later, the child returns to the office with another streptococcal infection. Staphylococcal. The patient's medical records indicates that she's had repeated bouts of staphylococcal and streptococcal infections for her entire life. Patient most likely has which of the following types of immune deficiency?
A for apple.
Okay, Divya?
Same.
Correct. The answer is A. And the key there was
albinism
and albinism. Correct.
Albinism.
Any questions about this one? Cool. Moving forward.
Okay. A 63-year-old male presents with new onset of low back pain, with pain and tingling radiating to the dorsum of his right foot and anterior ankle. He has 4 out of 5 strength of the extensor hallucis longus on examination of the right lower extremity. He has a positive straight leg raise on the right. An MRI is obtained at the L4, L5 level. Shown on imaging is directly responsible. So what that is shown on imaging, pointed by the red arrow, is directly responsible for his symptoms.
So the answer choices are here.
Yeah, so A, anterior longitudinal ligament, B, posterior longitudinal ligament, C, nucleus pulposus, D, annulus fibrosus, or E, ligamentum flavum.
You go back to the picture.
C?
Yep, I'm going to go with C too. I'm not sure what I was looking at, but I'll go with C.
So, yeah, C is right. The view of the picture is, I believe, like looking up from top. And the big black, it's like a very close-up image of the spine, looking from up top. Or maybe it's like an MRI, maybe a CT, looking from up bottom. No, wait.
It says MRI, so.
I think it has to be from top. Wait, yes. And essentially, now I'm confusing myself, but yeah, I believe
Should
the
I go
black
to the answers?
spinal
I
cord.
think the explanation.
Yeah,
might-
yeah. So it's L4, L5 level. So yeah, I believe the big black blob is the cord, where the cord is, and then the most anterior, posterior is supposed to be the spinal cord vertebrae, and the middle, that white, is the nucleus pulposus. So that cartilage material in our spine. No cord makeup.
Okay.
Moving on.
A 72-year-old male presents with mild abdominal discomfort, jaundice, and itching. He notes a weight loss of 15 pounds over the last 3 months. On physical exam, he has sclera, or his sclera are icteric. He appears tachycardic, and the gallbladder is palpable in the in the abdominal right upper quadrant. His CA 19.9 is 10. 145. Oops, I was supposed to look that up to see if I can explain that to you guys more, and I guess for myself. But you plan for possible surgical resection, but want to rule out metastasis disease first. Where is the most likely site of metastasis for this tumor? A, brain, B, bone, C, liver, D, lung, E, adrenals.
Pancreatic cancer, so
B.
metastasizes in the liver.
So A, B, or A, C. The answer is the liver. And the explanations aren't the best. Besides, it's just a fact, I guess. Pancreatic cancer metastasizes to the liver. It can to the adrenals, but it's not the most common site. Brain is not the most common site for pancreatic metastasis, but it is for others. Lung is second most common after the liver, and pancreatic cancer is more likely to metastasize to the liver and lung before the bone.
So I guess, Divya, you're right, but out the liver and lung before the bone.
Yeah.
Cool. All right. Any questions? We're moving forward.
Yeah, it's just not one of the most common first aid has sites of metastasis that we need to know, but would be a great NBME CBSE question.
Alrighty. A 5-year-old male is exposed to latex gloves during a minor surgical procedure and is subsequently found to produce anti-latex IgM antibodies. Several months later, he develops a severe allergic reaction to latex and is found to have a high level of serum anti-latex IgE antibodies. Which of the following cytokines is most likely responsible for this anti-latex antibody isotype change? IL-1, IL-2, IL-3, IL-4, IL-10, or IL-12?
D for dog?
D is correct.
So D is correct, and can anyone name what the other ones do?
So IL-1 is fever, most commonly. What else is it? Something else. I know fever is the most common, but I think there's something else too. Not neutrophil chemotaxis, but can't think of it. IL-2 is T cells. IL-3 is hot T steak. Yeah.
You're missing a word
The
in there.
class with I am bone.
So that'll be
So
your
B cells.
B cells and your bone marrow.
Then steak, IL-4 and IL-5 for the class switching.
IL-4 for E, IL-5 for A.
Okay. 6 is not on here, but accused phase reactants. I forgot. Crap, what's 10 and 12?
You got most of them.
12 is TH1.
Yes.
And
Yeah.
it's, crap. Crap. This is TNF beta?
Mm-mm.
Something with immune response. I know that. But I don't know.
Well, you can go ahead and reveal the answers now. So, for IL-1, Tulsi, fever, and it recruits white blood cells also. I think that was the other one you're going for.
Yeah.
IL-10, a 10 U8s the immune system. So IL-10 and TGF-beta tell the inflammatory response to calm down. And then IL-12 is promotes differentiation of T cells into Th1 cells and also activates NK cells. So your natural killers. That's what happens there. Any other questions? Alrighty. A 25-year-old woman is being evaluated for a possible inherited disorder. She has a 6-year history of generalized tonic-clonic seizures, and a year ago she had partial loss of vision due to an occipital infarction. Her mother has chronic intermittent muscle weakness and lactic acidosis, and her maternal uncle has hemiplegia. Skeletal muscle biopsy of the patient shows ragged-appearing muscle fibers. After further evaluation, all the affected family members are found to suffer from the same inherited disease. Pedigree analysis is shown below. You can see right there. Which of the following is the most likely explanation for the variability of clinical manifestations in the affected family members? Anticipation, heteroplasmy, incomplete penetrance, mosaicism, and uniparental dysemy.
It's not anticipation. I can rule that out.
Okay.
I think I'm going with. Wait.
Let's see.
Okay, I'm a little confused. So clearly we're talking about mitochondrial disease, but mother has chronic intermittent muscle weakness. Like, okay. Oh, and that I think I'm thinking B for boy.
Okay.
Yeah, I think so.
Yeah, based on ruling the rest out, I'll probably go with B too.
B is correct. So, heteroplasmy has to do with mitochondrial inheritance and the variability of clinical manifestations within mitochondrial inheritance specifically. So, that's a big clue there. So yeah, do you guys need me to explain any of the other ones? Are we good?
At least for me.
Yep, that's good. Got it.
Oh, and the family has.
Is it please?
I'm sorry?
Is this the disease?
The family has mitochondrial encephalomyopathy, characterized by the neuromuscular lesions, ragged skeletal muscle fibers, and lactic acidosis. So that's what they have.
This almost looks like the exact mitochondrial pedigree from first aid. Almost.
Pretty much. So you have mom spreading it to all her offspring, and father's not spreading it to anyone.
It's good. It's a good review.
So yeah.
Good question. That's all I got for you guys today.